Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be covering fundamentals of nursing. This is going to be another Kahoot. Now, even if you are um, far surpassed that in your nursing program or you've already graduated, guess what? These are important concepts you still got to know. So you're going to love this video. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you can sign up for a private one-on-one tutoring session with me. You can sign up for a next generation NCLEX review, part 1 and part 2. In part 1, I teach you how to think like the test writers. I teach you about different situations and different wording, and I teach you about priority and delegation. And in part 2, we actually go over NCLEX type questions, the concepts that you need to know and that you need to understand and be really secure in. So I encourage you to sign up for both part 1, part 2 if you've already graduated and you're studying for your boards. If you're a current student, you can sign up for audio lessons. If you really need to get a really high grade on your next exam, I encourage you to check out the audio lessons I have available and see if I have one that matches your upcoming exam. Oh, I almost forgot. Within the next couple weeks, I'll be rolling out my Nexus Nursing Test Bank. And basically, these are going to be questions for you to practice if you are taking your boards. These are concepts that are important to know. And I keep telling you guys as students, stop trying to memorize questions. You're not going to see the same question again, but you'll see the same concept, right? So what you want to do is understand the rationale, because from one rationale, I can create 1,000 test questions. So that's going to be rolling out soon. And just keep your eyes and ears open for more announcements for that. Okay, guys, without any further ado, let's get started. Fundamental concepts. All right, first question, true or false? An incident report should be documented in the patient's medical record. Is this true or is this false? Now, guys, the information we're going over, this is stuff that you're going to learn your first semester of the nursing program. This is a very basic fundamental concepts that you should know. Okay, true or false? The incident report, should that be in the patient's medical chart? Very good. False. It's concerning that 22 of you guys chose true, but the answer is false. Incident report should never go into the patient's medical chart. As a matter of fact, there should not even be a mention of an incident report in the patient's medical chart. You're not even allowed to document the existence of an incident report in the medical chart. That incident report that goes in a completely separate location. It is independent of the patient's medical chart. This is something that is for the facility and for the facility only. This is so that they can have processes in place to do better next time. So whatever went wrong, so it doesn't go wrong again, right? It's not there for the patient to be able to sue them. It's not there for, punitive measures. It's there for safety to prevent whatever it is that happened before, to prevent it from happening again. If you guys are new, you've never done a Kahoot, you weren't able to get in, you can still participate. Just go ahead and type in your answers on the live. All right, type in your answer. How many minutes should you wait before taking a patient's oral temperature if they've been eating, drinking, or smoking? So how many minutes? What is the minimum time? How many minutes should you wait before you take a patient's oral temperature if they were eating, smoking, or drinking? Type in your answer. Ten, 30, 25, 10. That is the minimum amount of time, because you want to make sure that temperature you're getting is accurate. If the person just had ice cream, you don't want the temperature of the ice cream. You want the temperature of what's going on in their mouth. Or if they smoke, smoking causes vasoconstriction, or if they drink something hot or cold, such as coffee, right? So you want to wait 10 minutes. All right. Paroxysm of breathing, often seen in metabolic acidosis, is known as what? Is it Kussmaul, tachypnea, bradypnea, or apnea? Paroxysms of breathing, often seen in metabolic acidosis, is known as what? Kussmaul's, tachypnea, bradypnea, or apnea? Very good. Kussmaul's. Now, tachypnea, that's increased respirations. You know, respiration's supposed to be 12 to 22. Bradypnea, that's decreased respirations, less than 12. And apnea, whenever you see an A before that word, that means to be without. So apnea is what? Without breathing, not breathing. Okay, a blood pressure cuff that is too large causes the reading to be blank than it actually is. Higher, lower, stronger, or weaker. A blood pressure cuff that is too large will cause the reading to be blank than it actually is. So if that blood pressure cuff is too large, the inaccurate reading that you get, will it be inaccurately high, low, strong, or weak? What do you guys say? Very good. It's lower. If the blood pressure reading is too large, your reading will be inaccurately low. And the opposite, if your blood pressure cuff is too small, it's too tight, it's too small, you're going to get an inaccurately high reading. That's very important. Make sure you know the difference. Select all that applies. Which type of patients must a registered nurse keep? That means the RN cannot delegate this type of patient to anyone else. Here are your options: blood transfusions, IV fluids, central lines, piggybacks, IV pushes, PCAs. Yolanda, thank you for sharing the live. Thank you. So what type of patients or nursing interventions would the RN have to keep? Under no circumstances can they delegate that to anyone else, such as an LPN and LVN. The code to get in is 734-197. All right, let's talk about this, guys. Blood transfusions. If a patient's getting a blood transfusion, they are in a critical state, they're not stable, LPN, LVNs cannot do blood transfusions. The RN has to keep that type of patient. Central lines. That is not a stable patient if they have a central line. Okay, we have to be so careful with central lines, right? We're worried about infection. We have to be careful. No way. RN has to keep a patient that has a central line. IV pushes. It is very easy to a patient that has to get an IV push. That patient's not stable. We are not going to delegate that type of patient. Piggybacks. You got to be very careful with piggybacks. RNs have to keep that type of patient, and PCAs. If a patient is on a patient-controlled analgesia machine, that's a PCA. Guess what? RNs got to keep that type of patient. IV fluids, guys, I can't even think of a state that the PNs cannot do IVs. Now they may have to get a special certification, right, after the license, but they can still do IVs. They can still do, normal saline, lactate ringers. What they can't do are piggybacks. What they can't do are pushes. What they can't do are central lines. But IV fluids, no, they can do that. So just know piggybacks, pushes, PCAs, blood transfusions, central lines, the most critical type of patients the RN has to keep. They cannot delegate that to anyone else. All right, select all that applies. What type of patients would you expect to be on reverse or protective isolation? Select all that applies. Here are our options. Patients that are getting chemotherapy, patients on long-term steroids, patients that have HIV or AIDS, patients with severe burns, patients that are diabetic, or patients that have hypertension. Select all that applies. What type of patients or diagnoses would you expect for that patient to be on reverse or protective isolation? There's more than one answer. Okay, let's talk about this. I'm very happy that almost none of you guys chose the wrong answer, which is diabetes or hypertension. Someone with diabetes or hypertension, that alone is not enough to put that patient in reverse or protective isolation. And why is it called reverse or protective? Because they're in isolation, not to protect the public, but to protect them, which means what? They're immunocompromised. We are concerned about them getting an infection because they are immunocompromised. Obviously, a patient getting chemotherapy, right? Because the chemo is going to kill those bad cells, but they'll kill the good ones too. Long-term steroids. What do we know about steroids? Couple things. We love steroids. They decrease inflammation, but they mask those signs and symptoms of infection, right? Patient who's on long-term steroids are going to be immunocompromised. We're going to be worried about infection. We're going to be worried about stomach ulcers. We're going to be worried about hyperglycemia, and we're going to be worried about them developing stomach ulcers because they're very hard on the stomach. That's why you never give it on empty stomach, you give it with food. Patients with HIV or AIDS, because that disease alone causes the patient to be immunocompromised, and there are higher chances for opportunistic infections. Patient with severe burns, well, think about it. Why would a patient with a severe burn be immunocompromised or at risk for infection? What is your first line of defense against pathogens and viruses and fungus and all that other crap that we don't want to deal with? Your skin. So when the integumentary system's compromised, such as a patient with a really bad burn, that is a perfect environment, perfect medium for bacteria and pathogens to set in for the patient to get an infection. Okay? How are you guys doing on the live? Very good. Thank you. Let's keep going. All right. What problem can a lack of exercise cause? Osteoporosis, joint contracture, muscle atrophy, urinary tract stones. And to be honest, although all of these options can potentially lead, be caused by lack of exercise, among other things, nursing is all about choosing the best answer. So if you had to just choose one out of all these options, what would it be? Let's use our critical thinking skills. Very good. Muscle atrophy. If you're not exercising, you're not using those muscles, what do you think is going to happen? Those muscles are going to start to shrivel up, right? Muscle atrophy. Now, osteoporosis, there are lots of risk factors for osteoporosis, and one of them is being a couch potato, not being physically active, not doing weight-bearing exercises, because we know that weight-bearing exercises helps to push the calcium that was hanging out in the bloodstream to go back into the bones where it belongs to make the bones stronger. But we're not going to choose that when we have muscle atrophy right there. Joint contractures. Lack of exercise, not moving those joints, right? You can do exercises to move the joints. You're not moving the joints, that can cause those joints to be stiff and the patient can have contractures. But we're not going to choose that when we have muscle atrophy right there, which is by far the best answer, because that's one of the first things that's going to happen from lack of movement, right? And urinary tract stones. You're not moving about. When you don't move, fluid, period, slows down, right? Everywhere. Your bloodstream, urinary tract, that's just what happens, right? So yes, you can have buildup urinary tract stones, but guess what? That's down the line. It's not going to happen as fast as muscle atrophy. So by far, muscle atrophy is the best answer. And that's how you guys need to be thinking when you're looking at these options and you see two or more options that could be the answer. You have to get the best answer. Select all that applies. All right, what are the risk factors for pressure ulcers? Select all that applies, and I'll tell you now there's more than one answer. What are the risk factors for the development of pressure ulcers? Immobility, incontinence, poor nutrition, poor circulation, diabetes, peripheral vascular disease. What do you guys think? Not kaboom.it, kahoot.it. Kahoot.it. Again, your options are immobility, incontinence, poor nutrition, poor circulation, diabetes, and peripheral vascular disease. Okay. This is interesting because on the live, I saw a lot of comments, everything except blue, everything except purple. And here I'm looking, and not as many of you guys chose the blue or purple. So let's talk about all of these are risk factors for the development of pressure ulcers. Immobility. In order to keep pressure off of one area, you have to be mobile. You have to be able to move, right? If you're not moving, pressure is going to stay on one area, and the patient's going to be at risk for pressure ulcers, especially if it's a bony area. Incontinence. Of course, incontinence is a risk factor. I want you to think about it. If you are incontinent of your bowel or your bladder, you can't control it. So now you have feces or you have urine sitting up against your skin. Don't you think that's going to cause maceration and cause decrease of skin integrity and cause a weakness? Of course it will. Absolutely, that can cause pressure ulcer. Poor nutrition. Not eat. Listen, looking at me, you know I got. Well, let me not. Just joking. Poor nutrition. Let me focus. If the patient has poor nutrition, they're emaciated, they're going to have bony prominences. Don't you think that's going to put them at risk for pressure ulcers? Of course it will. Poor nutrition, not having enough protein, right? Protein helps build what? Muscle, helps with wound healing. Of course, poor nutrition is going to put you at risk for pressure ulcers. Poor circulation. If blood isn't going where it needs to go, those tissues aren't being fed, because remember, blood is what's carrying the oxygen, the vitamins, the minerals, the nutrients that the tissues are feeding off of. And that goes hand in hand with peripheral vascular disease, because guess what? If you have PVD, you don't have good circulation, right? And last, diabetes. Guys, diabetes like literally affects every single organ system that you can think of. Okay, patients got diabetes, causes peripheral neuropathy, you lose feeling. Yes, you're going to be at risk for pressure ulcers. All of these are risk factors. You need to know that. How are you guys doing on the live? Yep, necrosis. Tissue's going to start to die. Absolutely. Very good. All right, type in your answer. Restraints require a physician's order every blank hours. In order for a patient to remain in restraints, right? That would require a physician's order every how many hours? Type in your number. Ooh. 2, 1, 4, 3, 8, 24. The answer is 24 hours. The order for restraints has to be renewed every 24 hours. And guess what? Can't be over the phone. The healthcare provider, the physician, has to actually physically go to that facility, assess the patient. They have to see that patient and rewrite that order. Okay. Is this fundamentals? Yes, it is. This is fundamentals of nursing. All right, which is not an indication for the application of heat. Why would we not apply heat to a patient? Relaxing muscle spasms, for vasoconstriction, for comfort, or to reduce congestion, which is not an indication for the application of heat onto a patient. Relaxing muscle spasms, vasoconstriction, comfort, or reducing congestion. Very good. Vasoconstriction. Heat does not cause vasoconstriction. Cold causes vasoconstriction. Heat does the opposite. Heat causes what? Dilation, right? So when we apply heat, we may be applying heat to relax muscles. We may be applying heat to provide comfort. We may be applying heat to reduce congestion because of that vasodilation. But what we're not applying heat to do is to cause vasoconstriction. Very good. Last question. This is a puzzle. What's the correct order of an abdominal assessment? Here are your options. So take your mouse and put in the correct order. Palpation, auscultation, inspection, percussion. So if you have to palpate, auscultate, inspect, percuss, what would be the order? You're doing an abdominal assessment. You're doing a GI assessment. In what order are you going to perform your assessment on your patient? We're covering fundamentals of nursing, your first semester of the nursing program. Wow. Okay, so let's talk about this. Only 19 of you guys got this right. Here's the thing. Let's say you're confused, you're not sure what to do. Your best bet is to go from least invasive measure to the most invasive measure, okay? And that's across the board, anything in nursing. So the first thing you want to do is eyeball them, inspect, look. That's the least invasive measure. All you're doing is looking at them. You're not even touching them yet. You look. After you look, then you can take your stethoscope and listen. You auscultate, you hear, right? You're not tapping, you're just listening. After auscultation, percussion. Percussion's very light, but percussion helps you because it helps give you an idea of the size of organs such as the liver, right? And last, you want to palpate. And the reason palpation is last is because when you palpate, you may cause movement of fluid, gas, but it's caused because of your palpation. That's not really what's going on independently in that patient's body. You caused that to happen. So that's why we're listening first before the palpation. Okay? I hope that makes sense to you guys. This was very quick, guys. It was only 11 slides, Foundation of Nursing. If you feel like I went too fast or this is something that you want to review, just give me an hour and this is going to be up on YouTube and you guys can play it and take notes as needed. But these are some very basic concepts, especially if your school has like each semester you guys have an exam that you have to take that covers everything in that semester to move on. I'm telling you right now, those 11 slides that I just covered, most likely you're going to see them. You're going to see that content. They're very basic but important things that you guys need to know in order to move on. So give me an hour. I'll be up on the YouTube, on my YouTube channel, Nexus Nursing. Now let's see how you guys all did.